Namaste. My guest today is Dr. Hari Kumar. I am sitting at Vaidyagram. It's an Ayurvedic healing village, as they call it. It's a beautiful place over here. About 5 acres, lovely greens, and lots of wonderful Ayurvedic doctors and therapists to heal people. I'm here for a healing session and thought that I will do a little interview with Dr. Hari Kumar, who is my physician right now, and I had some very interesting conversations with him. Sir, namaste.
Namaste.
So let's start with maybe a question on the key difference between Ayurveda and how modern medicine looks at healing the body.
When we are talking about a medical science, nowadays people are thinking that the treatment given to one person and for a period the doctor is treating, and by reducing the symptoms it will be stopped. Like that, the medical science is like that, it is considered. But Ayurveda is not like that. It deals with all aspects of your life, even the nature, the climate, what are all the climatical changes which is making the changes in your body. And also it is told that Bhumi Desha Prabhedena, that Deha Mahu Rigatudha. That is Bhumi Deha Prabhedena means Bhumi means the earth. That wherever you are living, that place is also divided. Jangala Desham, Anupa Desham, Sadharana Desham, like that. If you are living in a Jangala Desham, that is just like in Tamil Nadu, some part is very dry. There, when we are living, how the body will be. When we are living in Anupa Desham, that in dry places, the people will be more healthy because it is difficult to live there. And in Anupadesham, that is marshy places like in Kerala, they are susceptible to get more diseases, and the Kapha dosha will be more. Here the Vata and Pitta will be more in the Jangala Desham. Sadharana Desham is good for living.
Okay.
Like that, in particular climates, there are 6 ritus, seasonal changes. When we are in summer season, our health will be absorbed by the nature. That is Adana Kalam. In some ritus are Adana Kalam. It is taking out our health. Then we have to take some nourishing food, like we can take milk. Like that, more nourishing food we can take.
Okay.
But in other climates, it is not needed. And when the climate is summer, there is a starting of increasing of Vata will be happen. Next, the rainy season will come, and then there will be cold climate along with the dryness. Then the Vata will be completely aggravated.
Okay.
Like that, whatever is happening in our body according to the climate is told. Like that, the food items, aharam, that food items, how to take, what are all the qualities of the food. Nowadays, if I am telling you that you are having so much of fatty body, you should not take rice or wheat like that. That is carbohydrate. That is told in Ayurveda, that sweet tasted food items. These are having Madhura Rasa.
Okay.
And if you are taking too much of this, the medas will be increased. That is told in Ayurveda. What are all the rasas? 6 tastes are there, and these rasas, when we are taking the what are all the things happened in our body, it is told. When we are taking this Madhura Rasa Dravyas too much, means there is a chance of getting more accumulation of medas, and medo dosha will be happen. And there is a chance of getting the diseases with this medo dosha. That is mainly diabetes, BP, high BP, cholesterol, like that, or thyroid problems you may be getting. Like that, so many diseases told in Ayurveda. And like that, it is described that viharam activities, when we have to do the exercise. In summer season, we have to reduce the exercise because our general health is reducing.
Okay.
And like that, it is told everything, every aspect of life. We cannot say a treatment for 1 week or 2 weeks, finishing everything, and we have to follow the lifestyle properly.
Not only 1-2 weeks, but here though, I mean, like this symptom.
When we conceive in the mother's womb, from there to death, that treatment continues. Then, for a particular period, we can go for a treatment like that. It is not told. We have to follow the all the rules of Ayurveda for a healthy life, and it is divided into two: Swastha Vrata and Adhara Vrata. Swastha Vrata is for the healthy person, how to maintain that.
Okay.
And Adhara Vrata is for the patients those who are having the disease, and it is another part of Ayurveda.
Okay.
And it is told like that. In modern science, it is not like that. It is giving some medicine and
For heart problem, one medicine.
yeah.
Same heart
This
problem
is a
in
holistic medicine. When we are getting an acne in the face, the same dosha may be responsible for getting a joint disease or a heart disease or a pancreatitis or a hepatitis. Same thing can happen in different sites according to the accumulation or transfer of that doshas. It may happen, same thing. Then we have to treat in a holistic manner.
So you're saying what in a person is causing acne?
Yes.
The same thing, same dosha, could be
can,
causing
if it is transferred to some other,
joint.
shifted to some other, accumulated in some other place, may make the same thing, may make the arthritis like that. If it is accumulated in some other place, that may make that everything is itis in modern science. Like that, it may be the same thing may make all these things.
Right.
And the modern science is telling that our immune system itself is a disease-making thing.
Yeah.
And
autoimmune
condition.
disorders.
And inflammation is a disease.
Yes.
Fever is a disease. Like that, it is told.
Yeah.
But in Ayurveda, there is another concept about that. And that immune mechanism is not making the disease. When the immune mechanism is working, in a healthy person, silently it is working properly. Whenever he is getting such accumulation of toxins, that is accumulated along with the immune mechanism, and that is making the disease.
Okay.
For example, some doshas are making a channel blockage, and our skin is getting dryness. That is because of the circulation is not getting proper. The body is not able to moisturize the skin properly. Why it is happening? In modern science, they will make some moisturizers like this.
Correct.
It is not getting proper circulation to the skin. That is because of the blockage of the channels. When we are giving some medicines by diagnosing which dosha is making like that, or which type of toxin, that is ama, inadequately digested food, which is circulating in the body, that is blocking that channels. We can give some medicines for the root cause. You have to improve the digestion, you have to digest that toxins, then the circulation will be improved, and that will moisturize the skin.
Got it. And
then this dryness may affect the respiratory tract. This dryness may make some allergic sensitivity for the. You might have seen that somebody is getting contact with some dust or pollen, they will get a rashes here. That is the allergic nature of the skin. Why it is getting like that? Because the body's immune mechanism is not able to react against the whatever is in contact with the skin. Then it will trigger its action. Then it will become a rash.
So the allergen is not the problem. Allergen is only triggering a reaction. The problem is the skin is not getting enough.
Your body is healthy means we are sitting here and getting dust for both of us.
Correct.
In your body, the normal mechanism is working without any symptoms. In my body, it is not able to do that, and it will trigger its action. It is making some problem. Then to suppress that, we will modern science will give some cetirizine or something like that.
Correct.
Then that mechanism is suppressed. But the thing is there. Again, when he is exposed to dust, he will get the same. This same thing is when getting in the respiratory tract. The person is getting some allergic rhinitis or allergic asthma, allergic bronchitis or something like that.
Right.
Then this may go to our intestine.
So the disease is actually from the skin traveling to some other lung.
There are so many roga margas. The exposure of symptoms will be in different pathways. It will be. First, it will be through the external part, through the skin. The same, if it is increasing, means that will be to the respiratory tract. Then it will become to the intestinal area. Then whatever we are taking, that will make some problem. You can see that one is taking some sambar or something. Suddenly their stomach will work and start making the acid reflux. And that is also just like an allergy.
Yes, exactly. That is also
suddenly
like
it is
correct,
acting.
Correct.
At that time itself, the acid secretion is not increasing. That is because of this. Our immune mechanism is working in a different way there. Like that, in different parts, the same thing is happening in different sites.
So you mentioned doshas. For the audience, for the listeners, can you talk about what the doshas are and a little bit about ama after that?
You have to learn basically the Indian sciences. All Indian sciences are connected, and this mainly the dosha concept came from the Panchabhutas.
From Panchabhutas.
Panchabhutas. That is the basic concept of all Indian sciences. That how the gross form of this world created
is created.
That how the creation happened. That is Chaturvamshadi Purusha, like that it is told. There are 24 tattvas are there. There are so many things told. That is, there is a consciousness, that is Ahankara. That from the Mahan Ahankara formed. Ahankara means the consciousness inside I am, the feeling of I am. And this feeling of I am, that is an intelligence that got a desire to make to do the karma.
Yeah.
That for that there should be gross form. The subtle form cannot do anything.
Correct.
That when something is done like this, when you are doing, means that is a gross form.
Yes.
A subtle form cannot do any karma.
Correct.
Then that itself became the gross form.
Yes.
Then first it formed into a subtle form called Akasha. In that Akasha, the quality of Akasha is the Shabda Gunagam Akasha, sound is the quality of Akasha. This Shabdam means the vibration. The vibration which is the quality of Akasha, and when that vibration got movement, that is a force, that is energy, that is the Vayu. The Chandalatmakam Vayu. Chalana, the movement is the quality of Vayu. Then it became this energy when it is moving. From that, the Agni created, the heat produced. Up to that, there was no heat in the world. Then the heat produced. That produced heat means that is the lowest heat. That absolute temperature. Below that, there is no existence of matter. Then the heat slowly produced. Minus 273 degree or something like that. And it is becoming, heat is produced. Then that became the atom and molecule. The fluidity of that matter came. That is the water.
Water. Yeah.
Then this water became attached together and formed the solar thing. That is the grossest form.
Which is the earth.
Earth. That is the earth. Then Akasha, Vayu, Agni, Apa, Prithvi.
And in that order, that is the order of creation.
That is the grading of subtle to the gross.
Gross. Okay.
In the body, it is connected with the Vata, Pitta and Kapha.
So
that
these
is
five
Akasha and Vayu together formed the Vata.
Okay.
And Agni is Pitta. Agni with the Kapha, we can say.
Okay.
And the Agni with the Jala, the water. The water and earth together formed the Kapha.
Kapha.
That means our whole body, the Murta Rupa, that is the gross form of our body is Kapha. Not the mucus, or some are telling that the mucus is the Kapha and the bile is the Pitta. Like that they are telling. That is not actually, that are all the waste products of Kapha, the mucus and this Kapha.
So the whole gross body is actually Kapha.
Whole gross body, whatever gross form is there, that is Prithvi.
That is Prithvi.
Then fluid form is water. Like that, together this forms the whole body. You may be knowing that up to 70 or 80% is water. Like that, the body is Kapha. And whatever transformation is going on there, we are taking the food, it is getting transformed from the mouth itself, it will be getting transformed. And that is turned into the Rasa Dhatu. That is the first tissue formed from the after digestion. After digestion, the body the nourishing part will be absorbed, assimilated, and it will be turned into Rasa Dhatu. That is the responsible thing is the Agni.
Okay. What is Rasa Dhatu?
Rasa Dhatu, there are 7 dhatus, 7 types of tissues told in Rasa, Asrik, Mamsam, Medu, Asti, Madhya, Shukrani Dhatu. 7 dhatus are there. Rasam, Rektam, Mamsam, Medus, like that. Then this, when digestion is not correct, it may not digest 100%, digestion may not happen, and this absorbed thing may not be digested fully. Then what will happen? It will not turn to the Rasa Dhatu.
Okay. Which
is a separate thing.
Simply could be nutrition. Could we say that? Or forms of tissues?
No. It is a body tissue actually.
Body tissue, okay.
Whatever we took, that is digested.
Okay.
And that it is absorbed to the body. And that will turn to the body tissue. That is modern science also telling that in a leaky gut syndrome, that whenever the gut is getting leaked, the thing which is digesting, that is go on into the bloodstream. And whenever it is not digested thing, means our WBC cells can differentiate that, and it will engulf and it will digest. That means the body tissue is a different one. You got that? Fully digested and converted into a body part.
Yeah, okay.
The WBC cells will not act against Rasa Dhatu. Got it?
Yes.
Then, whenever it is not digested completely, means that will digest it. That is also Agni.
Okay.
You got that?
Yes.
Then the Agni should be preserved properly in the body to digest well and to transform all the dhatus from one to another, and that nourishment will be completed by digesting like this. That is the purpose of Pitta in the body.
Got it.
Whatever is transforming metabolism, all these things are happening because of the Pitta. And Kapha, Vata is the whatever energy is flowing, the movements are going on inside. That is Vata.
Okay, so all movements and including all excretion from the body is also Vata.
We cannot say excretion. Excretion is happening because of we are getting bowel movements. That the factor which is responsible to move that stool from rectum to the external, that is Apana Vayu.
Oh, that's okay. And
like that, each Vayu is there for responsible for each function.
Okay.
So when one person is urinating, that is because of the Apana Vayu.
Okay.
When one lady is getting menstruation, means that is getting because of the Apana Vayu. Like that, different types of Prana Vayu, Apana Vayu, Vyana Vayu, like that, it is 5 types of Vayus are so that it will be. Then this is Vata, Pitta and Kapha concept. Whenever our body, when we born in the mother's womb, the body's function will be proper if there is a percentage.
of each of the three doshas when
each
the
one will
child is
have
born.
its own that percentage.
Yes.
There may be equal percentage,
Okay.
70, 70, 70, like that equal percentage may be there. Sometimes it may be 70, 50, 20, like that.
Okay. So that defines the Pitta Pradhan person.
Yeah, like that the Prakriti will be Vada Prakriti, Pitta Prakriti, Kapha Prakriti, Vada Pitta Prakriti, Pitta Kapha Prakriti, Vada Kapha Prakriti, Tridoshaja Prakriti, like that it is.
Got it.
In that condition, our body will be working properly. If a kapha person means, now I told about all these things, how the kapha is.
Yes.
How will be the kapha person? Kapha person will have the all the things will be, the behavior, everything will be like the Appa and Prithvi, the water and earth.
Okay.
He will be having a heavy body,
Heavy built. Stout body.
slowly moving. His mind will be very calm. The skin will be very moisturized skin.
Okay.
The hair will be thick, hard, and blackish hair.
Okay.
And like that, he can tolerate anything. He can say that somebody is abusing. He will be calmly hearing that, and like that it is.
Okay.
Everything will be in a slow manner, like that. But in Pitta person, he will be aggressive. So if you are telling something, I will
respond back with the same abuse.
Yeah. His body will be very much heat transmitting.
Okay.
There will be Pitta smell will be there, like bile, like that. Pitta smell will be there.
Okay.
That skin will, the hairs will be like a coppery hairs will be there. You might have seen such persons.
Yeah.
The eyes will be more reddish.
Okay.
Aggressive nature, like that.
Yeah.
Always he will be getting appetite. He has to take something always, like that.
Okay. Some doctors I've come across in Ayurveda who say, oh, when a person walks in, we are able to make out his Prakriti. Is that possible without the Nadi Pariksha?
Up to an extent, we can say.
Okay.
Some part may be the vitiated dosha also may slow like that, show like that. That one lady came here. And she told that she learned some Ayurveda. I am having Vata Prakriti. She first she announced like that. Then I examined her and I told that she is Pitta Kapha Prakriti. And she got confused.
Okay.
All the people told her that she is Vata Prakriti.
And that happens, sir, because I've learned
she is telling like this because her skin is very dry. Her joints are making sound. The Vata Prakriti person will have a bony nature, and always they're knocking sound when he's moving.
So there are these online tests these days, if you like bony joints making noise, tick mark.
Yeah.
And
that
skin
will
dry,
not work
tick mark.
actually.
And they actually do that and they tell you that you are Vata Prakriti or Pitta. That doesn't work, right?
That will not work.
Okay.
Then she thought that all this, she is very lean from childhood, like that. Then I found out that she is having from the childhood itself, she is having Pitta Kapha doshas. And this is making some digestive issues and channel blockage, everything. That is why she is lean. She is having some channel blockage. That makes finally the joints dry and the skin became dry.
Very interesting. So one would say that if you're a Vata Prakriti, would you treat the person for Vata balancing?
No. That is not. That is a different thing. That in that Vata Prakriti means is basically the Vata nature will be there.
Yes.
You cannot change that.
Yes.
Then that means he is susceptible to get Vata aggravation quickly. And Kapha Prakriti is susceptible to get the Kapha aggravation.
And the associated diseases.
Yeah. That is another thing is that if a Kapha Prakriti person is getting a disease, in my OP, some patients will come. From the doorstep, they will come slowly and after sitting, only they will start talking. And they will talk about, oh doctor, I am having little knee pain. How long it is? About 10 years or like that. Do you have any other part getting pain? That is okay. It is tolerable.
Okay.
I am having little lower back pain. Like that they will tell because their tolerability is high.
Okay. So this
But if a pitta patient is coming from the doorsteps itself, they will cry and tell, "Oh, doctor, I am having pain
so many
here,
pain."
here," because they cannot tolerate.
okay.
We have to assess that this kapha person is having higher damage than the pitta person. Because of the tolerability, she is not telling anything. She doesn't want to tell anything because the holding is the property of earth.
Of kapha.
Then they will hold everything.
Nice.
Then we have to take out from her.
Extract information.
Extract we have to. The other person also will tell. He will tell that, oh, you are having knee pain. Then he will answer something else, shifting from one to another. Oh, doctor, I am having pain here. Like that. That is the shifting nature.
Okay.
Like that, we have to assess all the things, and we have to assess all the lifestyle also, and we have to give advice how to accordingly, and lifestyle we have to
And
change.
also medication.
We cannot blame anything that rice is not good. Because it is making too much of fat accumulation and high blood pressure, high sugar, high like that. We cannot say because some other person is there, he is doing good exercise and he needs more calorie and he has to take the rice.
Correct.
We cannot generalize anything.
So every symptom is not treated, which is how modern medicine works.
That is just like when we are going to Coimbatore 20 kilometers, we are getting a board will be there. We will get a direction.
Yes.
Like that, it is all the symptoms.
Okay.
For example, so many patients are coming with dry cough. They will tell that, oh doctor, I am having since 1 year or 2 years, I am having, even the doctors are coming, I am having cough. I was treating all the things Ayurveda, homeo, or allopathy, and I have to take, whenever it is aggravating, I have to take antibiotics and everything. Then it will subside little, again it will start. When it is told, we have to think that there is some other cause behind that. Then when I am examining, then the examination will reveal that he is having so much of acidity. Then what will happen? This acidity, acid is coming up, acid reflux, by the acid reflux, acid is coming to the pharynx and larynx. It is burning that part. Then what will happen? This
so
burn is making the infection, easier infection. You got it? When I am treating them for acidity, all these
the
symptoms
cough will also go away. So you're not treating the cough, which modern medicine would say treat the cough.
And like that it is. If we are having some thyroid issues, that may be a reflection of so many things behind that.
Correct. And here they will give pills to manage the thyroid.
Yeah, it is due to the, you may get an autoimmune disease like Hashimoto's disease like that. You may get it. Why it is getting? Because the digestion is not correct. Your ama is produced. This ama you didn't treat well. You got the fever. You subsided it suppressed it with the paracetamol. Then what? The body was not able to digest all this inadequately digested food. Then what will happen? This will go deeply to the tissues. This is going to any organ like a thyroid, and when it is going to the deeper tissues, the body is not able to differentiate our tissue and the ama. Then the body will react. It is always trying to digest this ama.
Oh, so ama is actually like a tissue?
No. It is like whenever it is going to the deeper side. This will same as that it will go to the tissues itself.
Okay.
The body wants to digest that ama.
Okay.
Then it will the WBC cells will react against the ama along with our tissues. When it is going deeper, if you are not treating your fever properly, all these things will come after some time.
So let's come to ama.
Another thing is that this our immune mechanism is trying to digest this. then what will happen? The thyroid is getting damaged because of this. Then thyroid will not produce the hormone. Then that sluggishness will be there. The patient will get depression and he will not do any exercise or anything. This will make another disease. Like that.
So when the person goes for depression, the medical doctors will normally treat depression and give antidepressants.
Yeah.
But the cause could be thyroid, which could be because of something else.
Yeah,
could be
like that. So many things
Yes.
will happen in a chain. It will be.
Yes.
Then we have to find out the root cause when it is treated.
And how do you find that out? By say Nadi Pariksha?
Actually, Nadi Pariksha is one of the tool to find out.
Okay.
Everyone thinking that it is just like a palmistry or something like that. Even some patients after telling about something, I asked them, you are having this complaints. And after that, they asked me, how will be my future? How will be like that? They just like astrology. They are asking about. I have to tell them from the pulse all the future and everything.
You almost did that with me also, though.
That is, they are thinking like that.
Yeah.
But it is not like that. We have to get an idea how the kapha is working. If a kapha person is there, how will be his nature? His vessels will be very much elastic,
Okay.
thick and elastic. His blood will be very thick.
Okay.
You may be getting that why I am telling all those things. Very cooling.
Yes.
It is not heating.
Yeah.
And when the heart is pumping, how it will be? Slow pressure with the pressure it is pumping like that. Then how will be his pulse? It is
Will
just
be
like
slow, gentle pulse. Yeah.
when we are pressing, our finger will be pushing like this.
Okay.
You got that?
Yes.
We can understand kapha.
Yes.
I am giving you a basic idea.
Yes.
When pitta is there, it is aggressive, sharp.
Like the sarp. No, like the hansa or the sarp. I don't know.
Just understand this one.
Sure. Yeah.
This will, the heart will aggressively
Pump.
Then this will be hitting like this.
Yeah, got it.
Like a sharp thing, it is hitting.
Got it.
When we are pressing like this with the 3 fingers like this, then in the kapha, it can touch the first finger.
Okay.
Because that much pressure is there.
Yeah.
But in pitta, medium pressure is there.
Yeah.
But it is sharply hitting.
Okay.
That will be felt in the middle finger.
Got it.
And vata, pressure will not be there, but it will be like this, like a snake.
Like a snake. Okay.
Then that will not be able to give pressure to the.
But you feel the movement.
Yeah. That will be getting only in this finger because of that.
Got it.
And we can get each finger that one.
Okay.
That is when the kapha is hitting like this, we can feel the kapha here,
Okay.
pitta here, vata here, like that also. And from that we can assess that our kapha area is above the heart.
Okay.
That is the. And between the heart and navel region, that is the pitta, and the legs and hands, vata. That, and also we can tell the organs also accordingly.
Okay.
The pancreas is pitta, or the lungs kapha. Like that, we can differentiate.
Got it.
Whenever we are getting such a pulse in the this is kapha, and if we are getting a pitta pulse here means. That pitta is increased in your kapha area.
Okay. So the fingers, 3 fingers would be, this would be for kapha, pitta,
and
vata.
vata.
And but if you're getting
Pitta
in
sharp
in the kapha, then that means that
in kapha area the pitta is
high. But what does that tell about the person's prakriti? Is it now, right now it is high, or is it high?
That we have to. One thing is that it will take time to assess that.
Okay.
The differentiation will take time.
Okay.
That whether it is vikriti or prakriti.
Okay.
That for some it may not be directly, we cannot assess. It may take 1 or 2 or 3 days or longer than it may be
Continuously
according to
testing the person, is
yeah,
it?
yeah.
Okay.
That is because I told you about the Kapha Prakriti person got the knee joint pain like that.
Yes.
This Kapha Prakriti person will not show the symptoms.
Right.
That then we have to assess from this person is Kapha Prakriti, and he is having more aggravation of Pitta from that, and how much it is. When we are assessing only like that, only we can get the how much Pitta is aggravated. If the Kapha is aggravated, he will show more symptoms. If Pitta is aggravated means if we are firing a dry wood, it will be getting easily fired.
Yes.
But if freshly cut wood means that will not get fired.
That's correct.
Why? There is water content is there.
Yes.
Like that it is. The Kapha Prakriti will have more water content and more Prithvi part. Then it will be getting this Agni, it can tolerate the Agni. You got that? If it is dry means that will get more fired.
Yes.
Like that we have to analyze that, and we can get the Prakriti from that.
I heard that from some doctors that sometimes you have to get up 4 a.m. in the morning, not eat anything, not even water. Only then we can do a Prakriti test. Is that possible?
A fresh person with a good pulse, we can assess more.
Okay.
It is difficult to get like that when the person is coming. He might have traveled for 30 hours from US.
Then you can't.
Jet lag will be there, and we have to get time to settle down all the functions. Then only we will get up.
So I mean, yes, very good conversation so far. I have so many more questions, but then I guess we'll end this here with this introduction. Thank you very much. So thank you. Hope you all enjoyed the introduction to Ayurveda with Dr. Hari Kumar in this beautiful place in Coimbatore, Vaidyagram. And if any one of you or your family members need treatment, please come here. It's really, really wonderful. You can go to vaidyagrama.com and find out more about this center.